Your patients want you involved in their overall health, and you can be. By offering blood pressure screenings at every visit, dentists can help detect early signs of heart disease. The American Heart Association's Healthy Smiles, Healthy Hearts initiative, in collaboration with Delta Dental, gives you the tools to do just that. Learn more at heart.org/healthy smiles. That's heart.org/healthy smiles. Hey everybody, welcome back into another edition of the DrBicuspid.com podcast. My name is Kevin Henry, editor-in-chief for DrBicuspid.com, and I'm thrilled to welcome back Michelle Coker. Michelle, it's good to see you again.
It's good to see you too. Thanks for having me back. I really appreciate it.
Hey, love having you back. I know anytime that we have you, our readers kind of zoom in on what you're saying, and I have a feeling today's topic is going to draw some interest as well. Before we dive into that, I'd love for us just to know a little bit more about you.
Yeah, I am an employment law expert with CDA. I am celebrating my 20th year, so I'm super excited about that.
Congratulations.
And I'm always love the opportunity to impart a little bit of wisdom, especially on a fun topic like this when it comes to HR.
Yeah, so let's dive into it. You know, love is in the air as we record this. It's early February, Valentine's Day, all that stuff. Michelle, I've got to ask you. I'm just going to ask you some point blank questions here. Is it okay for a dentist to date a patient?
Generally, that's a red flag. I think if you truly, I mean, you never know where sparks are going to fly, right? And I think that's something you need to explore as from a professional boundary type situation. May want to rely on your liability company, your risk management team to discuss next steps. Chances are, if this is something you truly want to explore, because it really blurs the line of um the dental care and confidentiality, harassment if things go wrong, probably want to dismiss that patient or refer to one of your trusted colleagues before exploring that relationship.
I love the maybe shuffle off to a colleague, but you can still date. So that hey, nothing wrong with
It
that.
works. If this is, yeah, like I said, you never know where those sparks are going to fly.
Absolutely. Well, sparks can fly between a team member and a patient as well. So, and I can tell you, I know a hygienist that eventually married her patient. So it does happen. But I'm
Yeah.
curious, is it the same type of thing?
Yeah, it's funny. I know I have a friend who's a hygienist who also married her patient. Again, I think from an employment standpoint, there need to be policies in place that the employer has about conduct. Again, there's confidentiality issues. What happens if the relationship goes bad? You have to be careful with not overreaching your employer policies with regard to a consensual, bless you, a consensual relationship outside the practice, right? Because you really don't have control about what employers are doing beyond the practice walls, right? So you'd want to express that there shouldn't be special treatment of this patient beyond how you treat the rest of your patients, right? So there's no favoritism or anything like that. Yeah, I think you'd want to make sure that your employees are letting you know about the relationship that's occurring and that there shouldn't be any, PDA in the practice or anything along those.
Is this something that should be in the handbook or needs to be added in the handbook if it isn't already? You know, we've talked a lot about handbooks when you and I get together. So I'm
Yeah,
curious.
yeah, I tend to rely on policies a lot. I think you need to have a rules of conduct, right? That professional behaviors above all else are always required. Again, you need to make sure that those policies cover how you interact with patients, how you interact with one another, vendors, everybody, right? Nothing that's going to disrupt the workplace. If there's arguments, those should be taken off site. Again, those policies shouldn't blur the lines of what happens in a consensual relationship outside of the practice.
So I guess that ties into the big question about dentists and team members and any kind of dating that happens there. I've heard about it. I've seen some awkward situations that come of it. Is it something that should just be a flat no? Or again, is there something that maybe a handbook provides options for it?
Yeah, that's definitely a huge red flag because of the power dynamics. You generally don't want somebody in a place of authority to blur that line. And again, what happens when things go wrong? Or perhaps it's one-sided, right? And then you've got some harassment laws that fall into place. One pursuer is not, the pursuer is pursuing somebody who's just not interested. I again, that's a tricky situation because of those power dynamics. I would discourage that type of relationship. And again, if it's truly something that you want to pursue, it may be better if that employee isn't an employee, because it really can go wrong. And I've seen some situations where there's exes dating your coworkers, or obviously people who are married and, pursuing relationships
Yeah.
shouldn't be. I mean, it can get pretty messy out there. Again, I think keeping clear rules of professional conduct, maintaining those policies, and then if you've got employees who are dating one another, having a talk about what's expected and not expected, right? That there shouldn't be any, PDA in the practice, that if there are arguments, that those are taken outside. And truly outside, you wouldn't want to be interacting with this individual having an argument in the parking lot where patients could see it. Or again, taking that the romantic relationship outside where, it may be seen by patients. So you kind of want to take it off site so it doesn't disrupt the culture and the practice.
That's a great point. It is, and I often think about all the other team members that are in there if a relationship is going on, and just the friction that I've seen that cause in so many practices. Because even if you're trying to keep it a secret, it's a bad secret, and eventually it comes out.
It does. Employees know what's going on. And unfortunately, what happens is the employer is the last to know, right? You've got employees that are hanging out together because, teams become friends and they're hanging out together after hours. And next thing you know, you've got people who are dating one another and maybe something went awry. It always can be sticky. It can usually be sticky.
So, a question kind of in that realm, and I'm curious for your thoughts because I talk to dental assistants so often, and they feel like that there is a how do we say this? That there's always some kind of a bias towards some people that they love some more than others.
Mhm.
That there's a person who gets all the perks and can get away with everything, and others who can't. Even if they're not dating, there's still that tendency to think, "Oh, this person is held above the law." Is that something that you see often, and is it something that there's anything that can be done other than make sure there are policies in place that doesn't happen?
Yeah, I've had conversations where I've ascertained that there's a little bit of favoritism going on, and I highly discourage that. Again, because of retaliation laws, discrimination laws, everyone should be treated equally. Unless for some reason you have a policy indicating, let's say some employees get vacation time and some don't, but you have a standard policy that certain employees as a whole don't get vacation time. Employers should always have an open door when it comes to talking about pay and benefits and those types of things, because it's the law, right, under the National Labor Relations Board. So always be open to having those conversations because employees talk, right? They want to know, why is this individual paid more than me? Why do they get this benefit? So you should have documentation as to why certain employees get certain perks. But I think the open door communication and open communication is probably the most important in those instances, because if employees are feeling slighted, that should be a conversation, because I doubt you as an employer want your employees to feel that way.
Especially in today's staffing environment where we know keeping a team together is so vitally important today now more
So
than ever.
vital. Yeah, absolutely. Yeah, having an open communication is so important for retention.
Well, Michelle, I appreciate you playing the dating game with me here.
Yeah,
I appreciate that, and I
you're
appreciate all your
welcome.
insight.
Yeah,
So,
absolutely.
if somebody has questions, I know that you're involved with the California Dental Association, but still, if somebody has questions, there's a way to reach out and maybe pick your brain a little bit. What's a good way to do that?
Yeah, I probably the easiest is, well, you can either call me or email me. I can give my number. It's 916 554. My email is michelle.coker, COKER, at cda.org. Or you can call CDA's main line and let them know, reach out to me or my colleague Janelle Bell, who also takes employment calls, or just ask for an expert at CDA and let them know what you're calling about.
I always appreciate California Dental Association lending their experts to our Dr. Bicuspid readers for their advice and great thoughts. And Michelle, I always enjoy speaking with you, so thank you so much for your time.
Great, thank you. Hope to see you again soon.
Absolutely. And thanks to all of you for listening to this episode of the drbicuspid.com podcast. Yeah, some interesting topics we're talking about. What with love in the air at Valentine's Day, it's good to know what maybe isn't allowed, and what you need to be doing about it in your practice. Till next time, it's Kevin Henry, editor in chief for Dr. Bicuspid, signing off. And as always, wishing you nothing but success ahead.